If you have been getting recurring headaches, maybe you've seen a GP or 2 or 3 GPs, maybe seen specialists such as neurologists, or maybe you've done a scan as well, and annoyingly the scan comes back saying that, hey, you are clear, you are fine, but your headache's been killing you and you don't have a real answer. You gotta watch this video, okay? Because there's a good chance, a really good chance, that your headache isn't coming from your head at all. They may be coming from your neck. And if nobody has examined your neck yet, you haven't found the source of the problem, right? So my name is Nigel. I am a senior hand occupational therapist from Phoenix Rehab Group, Physio and Hand. So let's get into this video today. So there's 3 types of headaches, right? Before anything else, we need to quickly separate out the 3 headaches, the 3 types of headaches that most people confuse, because which one you have really completely changes your treatment avenues and what needs to be done. The most common headache is what you call a tension headache. This tension headache feels like a tight band around your head, squeezing both sides of your head. Okay, it's dull pressure, it's not throbbing, and this kind of tension headache, like the name implies, right, it's usually triggered by stress, poor sleep, or even dehydration. Panadol can bring down the pain, takes the edge off a little bit, and tension headache is the most common headache that people have. Next one, let's talk about migraine. Okay, migraine is a neurological event. It's usually one-sided, really one side. It's throbbing and can be severely debilitating. You might even throw up, you might get nauseous, you might be sensitive to light. Like, you know, there's a light right now for I'm using, even the sunlight, right? You might be sensitive to light, to sound, or even visual disturbances like flashing lights beforehand, called aura. And migraine can last from hours to days. It needs very specific migraine medication, and regular painkillers won't cut it, won't help. So migraine is a neurological event. We've spoken about tension headaches, we talk about migraine. Today I'm going to talk about this thing called cervicogenic headache, which is entirely different from the other 2 that I mentioned. This pain is also one-sided, which is why people always confuse migraine headaches with cervicogenic headaches. But the source of cervicogenic headache isn't your brain, isn't your head. It's a joint problem in the upper part of your neck, usually at the back here, close between the skull and the neck, right? Okay, the pain starts at the base of the skull, at the really base at the bottom of the skull, right? And refers forward. It goes to your temples, it goes to your eyeballs, or the back of eyeballs, it goes to your forehead, even it can go to at the back of your head as well. It's triggered mainly by neck posture and movement. And most critical, cervicogenic headaches does not fully respond to any painkillers long term, because most people are taking the wrong medication or doing the wrong thing for it. So the truth of the matter is this: there is an overlap between cervicogenic headache and migraine, okay? Because they all always said there's this similarity of being on the same side. They can cause eye pain, can cause light sensitivity, and that's the reason why people usually get misdiagnosed and wrong treatment for years. A neurologist examines your brain and your nerves, but nobody or not many people examine your neck joints, which is that's very near your skull, your head, right? And that's where our spine physios, our neck physios come in. That's a physio job. So let's talk about what cervicogenic headache actually is. Okay, there are 3 joints right at the top of your neck, just below your skull. It's called C1, C2, C3. Okay, and these 3 joints, right, they're the top joints of your whole spine bone. They share a nerve pathway with the nerves that supply to your skull, to your head as well, your temple and the area behind your eyes. When these 3 neck joints are stiff, when they're compressed or they're irritated, the pain can travel upwards or forwards, and your brain then get confused. It misreads where the signal is coming from, and they just recognizes or registers this pain as general headache. It's actually called referred pain lah. So the problem lies in your neck, but the symptoms happen in the head. Now, who gets this in Singapore? In Phoenix Rehab, Physio in Singapore, this is constantly seen in desk workers, people spending 8, 9, 10, 12 hours a day in front of a screen, in front of phones, with their head slightly forward, not moving their neck enough, and their necks are really like craning for a little bit. It's a bit like what they call a tax neck, right? And this creates a long stretch on the compression on the upper cervical joints, basically your neck joint, over weeks, not just talk about hours, days, weeks, months, even years. Then this creates the exact dysfunction that generates this type of cervicogenic headache. Pain, really pain one. Okay, the problem with cervicogenic, why it gets missed and what to look for, right? Here's a typical story. Okay, patients usually tell me this story. Okay, Nigel, my headaches are coming. My headache started. It started once, twice, maybe 3 times a week. So because I'm busy, I got work, my projects are here, I just take Panadol first lah. Okay, it works for a while. It takes off the edge a little bit, and then suddenly, you have to take Panadol more frequently. The painkilling effect of Panadol doesn't last as long. You see a doctor. A doctor before a specialist, but it's still there. Do MRI report is clean. Then you get so pissed off because like, Nigel, sir, madam, MRI clear. On one hand, you're like, oh my gosh, I'm so glad it's clear. But what is explaining this blasting headache, right? Nobody mentions the neck. Sometimes they do. Sometimes they don't know what to do with it. But the headaches continue. And this is not a failure of the system. There is a gap, right? GPs rule out dangerous causes and flag it up. Neurologists work on the brain. The cervical spine, right, is both the spine surgeon territory as well as the physio territory. But with cervicogenic headaches, there's nothing much you can do from a surgical perspective unless you want to opt for injections, which you'll be a bit scared to do if the benefit outweighs if the cons outweighs the benefits, and there's no surgery to be done. It's headaches, which doesn't warrant a surgery yet, right? And then, which is why the cervical spine is our neck physio territory, our neck physio area, right? So unless someone specifically say, hey, so and so see a spine physio, so and so see a neck physio, this often gets missed. Sometimes patients don't think, oh, it's just headache, who should I see? Doctor cannot treat, or doctor's medicine I'm taking already, that's all I can do. So no, there's also more things you can do. The spine physio can help you, right? If it's cervicogenic. So how to tell if your headache is cervicogenic? There are 4 signs that you can look out for. Okay, sign number 1 is always one-sided. It could be right side, left side. It could be at your eyeball, behind your eyeball, at the side of your head, or the back of your head. But it's always one side. Same side, same pattern, every time. One-sided. Number 2, your neck is stiff. I mean, I mentioned this, but sometimes patients, they don't even know that their neck is stiff because they're so used to it. They're used to stiffness that they think is normal, right? It's not necessarily painful, and people don't notice this. But when our physios, our neck physios, assess the spine, then they were like, hey, I turn one side is stiffer than the other side, huh? Yeah, my patients don't realize it. So the second symptom is that if your neck is stiff. Number 3, posture or specific posture, specific movement triggers your cervicogenic headache. Excuse me. This could be long periods of looking at a screen. It could be a long drive, reading, got to engross in a book, and then you got triggers your cervicogenic headache, or sleeping on a bad pillow or bad posture throughout the night. Especially like me, if I have children, they all move around at night, which explains why I got neck pain sometimes. If a specific position reliably precedes your headache, the good news is that we can identify the mechanical trigger and fix that. Okay? Number 4, if you press the base of your skull, if you trace your head, go to the back, there's usually 2 lumps that's very sensitive. Okay, if you press these 2 spots, and then you find that, oh, it reproduces that pain that you feel or intensifies your headache, that's your answer already. If 2 out of these 4 describes your condition, you likely have cervicogenic headache, and you likely need to see our spine physios to get that sorted out, right? And now let's talk about the mistakes that people keep doing that keeps them stuck. There's 3 mistakes, the 3 common mistakes that people do that keeps them stuck with cervicogenic headaches. Mistake number 1, they pop painkillers like candy. I understand. I'm busy too. I have young children, I have projects, I have business, I have patients. Okay, we need to function. Life goes on. I understand. The problem with painkillers is that it doesn't solve the real problem. It actually dulls and masks the problem, the pain, so that you can function, and it's useful for a while. But if you study your patterns and you realize that you've been taking painkillers for your neck pain, for your headache, for say 6 weeks, 12 weeks or longer, that's too long already. You gotta sort it out. Painkillers dull the pain, but it doesn't treat the joint causing the pain that's still there. It's untreated. So if you don't treat it early enough, it can degrade to other things, which I talk about the mistake number 3 later. And of course, taking medicine also, over time, taking painkiller you get desensitized to the painkillers, or you can also cause some allergic reaction to the painkillers as well, which can also trigger on headaches as well from painkillers. So painkillers are not the long-term solution lah. That's mistake number 1. Popping painkillers as a convenient solution. Mistake number 2, they assume that rest is enough. Oh, headache coming, I'll just lie down and rest. Headache coming, I go holiday. Holiday helps temporarily. Lying down helps temporarily. But when you go back to the same task, same job, same posture, same habits, and the headaches come back like clockwork. Okay? Rest will reduce the load on your neck, and that's why it will ease off the cervicogenic tension, cervicogenic pains. But it doesn't restore your neck joint mobility. It doesn't restore muscle function. You still need your neck physio, not just take a break. Break is nice, actually you should take a break anyway, but neck physio is what you need, right? Mistake number 3, and this is the most common mistake, especially for busy Singapore, right? We push things aside, we wait too long. Okay, we just wait because we're just busy and we have to schedule everything, right? The thing is this, if you caught it early, you treat it early, cervicogenic headaches respond really well. Most patients get clear improvement in 4 to 8 weeks. That's 1 to 2 months only. But what happens with most patients is that because life goes on, they're busy, things happen, they're left for months and years. And after months and years, in a certain posture, the joints will degenerate. Okay, the muscles will also adapt to suit the dysfunction and degeneration. Your pain nervous system becomes more sensitive. So last time it may take you 10 points to hit pain threshold. Now, within 2 points, you get more painful quickly and more painful than before. Yes, treatment will still work. Definitely still can work. If it's cervicogenic headache, 1 month old versus 1 year old, we can still treat. Just that if you catch the 1 month old cervicogenic headache, it can resolve very quickly. Unresolved cervicogenic headache that's been left for 1, 2, 3, 5 years, we cannot resolve it in 3 sessions lah. It will take longer than 4 to 8 weeks. Maybe expect 16 weeks or more, right? The window of recovery really matters. Now, if what I've shared before this, all this while matches what you feel, matches your situation, you gotta WhatsApp us, reach out to us, tell us about your headache, how long you had them, and we'll let you know whether this fits what we expect clinically and what we can treat or not. Okay, the link's in the description if you want to reach out to us. Now let's talk about the right treatment, right? Correct treatment is just two things, right? Number 1, manual therapy. You cannot skip manual therapy. This way we need to get our hands into the joints. We do hands-on joint work on the upper cervical spine. It's not massage. You can't just see any massage. You can't just see anyone. It needs to be a spine physio or physio with experience in managing the spine to mobilize gently C1, C2, C3, 3 joints to restore normal movement. Not about cracking, okay? It's really gentle, careful, accurate mobilization of the neck, not cracking. Neck is not somewhere that we should just simply crack on. Okay? We need to restore normal movement and reduce the compression that generating the pain signal that causing you to have your cervicogenic headaches. This is what that gives you the initial relief. Okay, we call it the left hook, right? No, the left jab, the quick one. But what is the really strong right hook is that you need to do your exercises. Okay, cannot skip one. If the first one, manual therapy, gives you nice temporary relief, exercise is what keeps the pain away at bay. We got to retrain your deep neck muscles. They are supposed to stabilize and support your cervical spine. So this is really what I'm going to repeat one more time. Doing this is what keeps the headache away for long term. Okay, without it, if you want to just do manual therapy, we can do for you, of course. We will help you get as much relief as you can. But manual therapy just gives temporary relief. And if you don't do the exercises, then you have to keep coming back. I'd love to have you back, but as a clinician, I want you to be truly free, truly independent. So we want to treat you in manual therapy, bring the relief in, but you got to do the exercises very correct, very accurate, correct, specific exercises so that the pain goes away permanently. We need to treat the underlying muscle dysfunction. Okay, so together, this combination produce lasting results, and that's what we do at Phoenix Rehab, right? So what to expect with us? Okay, most of the time the first session is usually you spend more time with assessment. We have to take your history, we have to examine your cervical spine, mobility, we have to palpate your joints, understand what's the nature of your joint right now, we have to test your muscles to give you and me a clear picture of what we're dealing with. If it's cervicogenic, we'll start treatment in the same session. Actually, we always start treatment in the same session. We can't just assess. We have to treat even on the first session, right? You will leave our clinic knowing exactly what the problem is, what the treatment plan looks like, what to expect, and what you can and should do at home. Right now, we have 3 clinics. We have in Orchard, we have Tampines and Serangoon. Tanjong Pagar clinic is coming up soon, on 1st of July. So if you're on corporate insurance, most Singaporean employees are. This is usually claimable under most major panels or insurance, but do check in your HR or insurance before you come in, okay? Now, if you've watched this far, you recognize yourself or someone you care about in this video. They and you have these headaches long enough. Okay, you've gone through the cycle. You've cycled GPs, cycled through specialists, maybe done MRI once or twice with clear MRI results, with still clear headaches, right? Now here's the next step. You WhatsApp us, tell our front desk, tell our therapist about your headaches, how long your headaches has been bugging you, what you've tried, right? We'll tell you, we'll assess it, and we'll tell you honestly what we'll expect to see, and if it's something that we can treat, we'll get you in. If it's something that we think maybe you see a doctor first for very specific condition, we'll tell you that too, okay, and point you in the right direction. So reach out to us, WhatsApp us, the link's in the description below. Take care of your neck. We only have one neck, and our headaches may depend on it. That's all I have for you today. It's a longer video, but take care, and I'll see you in the next video. Bye.